Good morning, chairpersons, and all the wizards and graybeards of vascular intervention present in the hall. Today I'm going to talk about the epidemiology of peripheral vascular disease. As described by WHO, peripheral vascular disease refers to a cluster of conditions in which narrowing and hardening of the blood vessels occur in the peripheral circulation, particularly in the legs. And as described by ACC and AHA, peripheral arterial disease encompasses a range of non-coronary arterial syndromes that are caused by altered structure and function of arteries that supplies the brain, visceral organs, and the limbs. PAD can be classified broadly into asymptomatic PAD and symptomatic PAD, and symptomatic PAD can be graded according to increasing severity into intermittent claudication, rest pain, critical limb ischemia, ulcers, gangrene, and acute limb ischemia. PAD, coming to risk factors of PADs, most commonly it is caused by atherothrombosis, but may reflect other diseases like arteritis, aneurysm, and embolism. Risk factors for atherosclerosis such as cigarette smoking, diabetes, dyslipidemia, hypertension, and hyperhomocystinemia increases the likelihood of developing PAD. When the risk factors coexist, the risk increases several-fold. And as we can see in this slide, the cigarette smoking is 4 to 5 times more associated with PAD, diabetes around 2 to 3 times more associated, and some newer risk factors were proposed like hyperhomocystinemia, chronic kidney disease, insulin resistance, and C-reactive protein. For the epidemiological study, asymptomatic PAD is generally studied by ankle brachial index. It is a valid and reliable marker of PAD, and symptomatic PAD is generally studied by WHO or Rose questionnaire and Edinburgh claudication questionnaire and various other methods. The incidence of symptomatic PAD increases with age, about 0.3 per year for men aged 40 to 55 years to about 1% per year for men aged over 75 years. And the annual incidence of critical limb ischemia ranges from 500 to 1,000 new cases per million population, and it increases in those with diabetes. And the incidence of amputation ranges from 110 to 250 per million population per year. Most epidemiological studies have used ankle brachial index to measure PAD. ABI is the ratio of ankle to brachial systolic blood pressure. The prevalence of PAD is based on abnormal ABI, ranges from approximately 4% in younger patients and to 15 to 20% in patients older than 75 years. As shown in this slide, the prevalence of PAD ranges in around 2% in less than 60 years old patients to around 20% in more than 75% of patients, both men and women. Prevalence is greater in men and greater in black. And the mean prevalence of intermittent claudication also increases with age to around 5 to 6% in about more than 70 years of age. And there are questionnaires to assess the prevalence of intermittent claudication. And one of the important points is that only 10 to 30% patients of PAD have claudication, and estimated prevalence of claudication ranges from 1 to 4.5%. And the prevalence increases with age and is more than men in women. As shown by this slide, prevalence of intermittent claudication also increases according to age, which is around 1% in less than around 30 years and comes to about 5% at more than 70 years. And one study was done in India, in South India, in urban population of Madras, which studied around 20,000 patients and found PAD patients of around 630 according to ABI, and the overall prevalence came to about 3.2%, with the 2.7% patients in the having normal glucose tolerance and 2.9% patients had PAD prevalence with impaired glucose tolerance, and 6.3% of diabetics had PAD. So this study also showed that the incidence of and prevalence increases with increasing age. Last slide for the prognosis. PAD is associated with fourfold increase in the risk of cardiovascular death, and more severe the PAD, worse the prognosis. Patients with critical ring ischemia who have lowest ABI value have an annual mortality of 25%. So in conclusion, asymptomatic PAD is more common than symptomatic PAD. Intermittent claudication is present only in 10 to 30% patients having PAD, so it is more important to diagnose. And for that, ankle brachial index is an easy and reliable method to diagnose PAD. And coronary artery disease is the major cause of mortality in PAD patients, and prevalence is probably less in Indian population, but we need a larger study to confirm this. Thank you.
Thank you. Thank you. We have 3 minutes for discussion. I'm surprised by your last phrase. In India, you have less, the prevalence is less than in other countries?
Than Western population.
Western population? Yeah. Yes? What is
probably less.
Diet?
The evidence is only this study, and we don't have any larger study, but we have to confirm that.
Yes, because I believe you are more diabetics than in other countries, because the population,
in diabetics also,
population is high.
Yeah, in diabetics it was almost equal. The prevalence was almost equal, came to around 17.6%. But in normal population, the prevalence was around 2.3%, which is around 4 to 4.5% in Western population.
Okay. Okay. Any question in the audience? No. And in arteritis, what is the prevalence for arteritis, Takayasu, and something like that?
I am not aware exactly about the prevalence or incidence, but it is more common in northeastern states of India.
Okay. Okay, thank you. So